So hello friends, so in this video I am going to discuss here about the histophysiology of testis and also histopathology of seminoma, and on the basis of the histophysiology of testis I am going to discuss the histopathology of seminoma, and also finally at the last I am going to discuss what are tumor markers of seminoma. Introduction, simply you should remember that the seminoma is the most common malignant tumor of testis, and second that this seminoma also corresponds to this germinoma in females. So these are the basic information or the introductory points of seminoma. So friends, so now I am going to discuss you about the normal histophysiology of testis. So this is the microscopic diagram of the normal histophysiology of testis. So see that in this normal histophysiology of testis, so numerous tubules are present, and these are the seminiferous tubules. So see that, so this is the seminiferous tubules and all these things are the seminiferous tubules. Now see that there is a space or a region is present between any two seminiferous tubules, and that region is known as interstitial stroma. So please remember that this interstitial stroma is present between any two seminiferous tubules. So two things I have discussed. So first is the appearance of seminiferous tubules, and also about the presence of interstitial stroma between any two seminiferous tubules. Now I am going to discuss also that some cells are present inside seminiferous tubules and some cells are present inside or within the interstitial stroma. So see that, so that these type of cells are the Sertoli cells. So you can see that in these seminiferous tubules, so here two types of cells are present. So first of all, that these are the Sertoli cells and these are the spermatogonia. So spermatogonia and Sertoli cells, these are the two different types of cells which are present within the seminiferous tubules. Now you should know that this spermatogonia, so here produce a cell that is sperm cell, and you should know that this sperm cell is also known as human male gamete because it helps in the fertilization. So this is a sperm cell and this is a spermatogonia. So this is the spermatogonia which produces sperm cell, and this is the Sertoli cell, and all Sertoli cells lie at the or towards the basement membrane of the seminiferous tubule, and all the spermatogonia, they lie away from the basement membrane and they lie towards the lumen of the seminiferous tubule. Just basic information. And also you should know that this spermatogonia produces sperm cells, and this Sertoli cell provides nutrition to spermatogonia. So this is the basic information about the seminiferous tubule. And also you should know that in the normal physiology that the basement membrane of the seminiferous tubule is not thickened too much. Now let's discuss about interstitial stroma. See that in interstitial stroma, so here that is only one type of cell is present, and that is known as Leydig cell. See that, so these are the Leydig cell, and also some fibers are present, but these fibers are also present within a limited number, and these are the interstitial fibers. See that, so these are the interstitial fibers are present within the interstitial stroma. And also you should know that in this interstitial stroma, so here other than Leydig cells, no other cells like lymphocytes, like leukocytes, eosinophils, neutrophils, and also so here that is monocytes or macrophages are present. So in a normal situation, you should remember that within interstitial stroma only one type of cell is present, that is Leydig cell, and also some fibers are present. So these are the basic informations or the features, microscopic features of normal histophysiology of testis. So see what I've written. So the first thing, that is interstitial stroma is present between seminiferous tubules. So see that these are the two seminiferous tubules, and between two seminiferous tubules interstitial stroma is present. And second, see that in interstitial stroma Leydig cells are present. So this is the interstitial stroma, and here it is Leydig cells are there. And third, that in seminiferous tubules spermatogonia and Sertoli cells are present. So these are the Sertoli cells and these are the spermatogonia, and you should know that the spermatogonia produce sperm cells. So see that, so in seminiferous tubules spermatogonia and Sertoli cells are present, and also spermatogonia produce sperm cells. And also see that the fourth point, as I've already mentioned, that in interstitial stroma the number of fibers and Leydig cells limited. See that, so here also fibers are there but in a limited range, and also Leydig cells are there in a limited range. And the fourth thing, as I've already mentioned, that within interstitial stroma that only Leydig cells are found, and other than Leydig cells no lymphocytes are found. No lymphocytes, leukocytes, such type of cells are found. So this is a normal basic information about the histophysiology of testes. Friends, so now I am going to discuss you about the histopathology of seminoma. So first of all, you should know that the seminoma is a malignant tumor condition of testes, most common malignant tumor of testes. So as I already said, that is tumor, that means tumor cells are present. So therefore you can see that, so in the case of seminoma, so see that, so these are the abnormal, so see that these are the abnormal tumor cells are present. Now you should see that all these tumor cells, they are arranged in a specific pattern, and that is known as lobulated pattern. See that, so this is a lobulated pattern, this is the lobulated pattern, so this is a lobulated pattern. So therefore I have written that that lobulated arrangement. And why lobulated arrangement? Because that these tumor cells are arranged in lobulated pattern. So the first thing. And the second thing, see that in this diagram, that is almost all the tumor cells, all these tumor cells, they are similar to each other in terms of appearance, shape and size. So therefore simply you can write that all these tumor cells are uniform in shape and size. So this is the second information. So by seeing this diagram, simply you can relate, that is the two basic informations. First about that is the pattern by which that is tumor cells are arranged, and these tumor cells are arranged in lobulated pattern, first thing. And second, see that all these tumor cells, they are uniform to one another in terms of shape and size. So see that the two informations I have written, that is the first, tumor cells are arranged in a lobulated pattern, first information, and second, all tumor cells are similar to one another in terms of shape, size and appearance. So 2 points I have discussed. So now I am going to give the description of each tumor cell. So first of all, as you already know that all tumor cells are similar to each other in terms of shape, size and appearance. Now I have drawn a single tumor cell to make you understand the characteristics of a tumor cell. So first of all, you can see that in this tumor cell, that is cytoplasm. So this is the cytoplasm, and you can see that the cytoplasm is clearly visible because of it contains glycogen. So therefore the first information I have written, that is the clear cytoplasm found in the tumor cell. And you can see that, so this is the central part, and here exactly at the center, so here nucleus is found. So that is a 2 points. So here that is in the tumor cell, that is the cytoplasm is clearly visible. That is the first point I have covered. And also you can see that at the center, that is the nucleus is located. So nucleus is located at the center. Now you can see that inside the nucleus, one more that is structure is found, that is nucleolus. And you can see that the staining of this nucleus is very dark, nucleolus is very dark. So therefore it is also known as hyperchromatized nucleolus. So what are the informations of its tumor cell? That in its tumor cell, that is the cytoplasm is clearly visible because it contains glycogen. So this is the first information. And the second, you can see that at the center of the tumor cell, that is nucleus is found. So therefore nucleus at center. And also you can see that at the center of the nucleus, there is hyperchromatized nucleus is found. So here at the center of the cell, so here nucleus is found, and at the center of the nucleus, so here hyperchromatized nucleolus is found, and since it stains darkly, so therefore hyperchromatized nucleolus. So all these are the information. See that in each tumor cell, so here there is nucleus is located at center. So this is the first one, there is nucleus is located at the center. And see that in the cytoplasm of its tumor cell, glycogen is present, so the cytoplasm is clearly visible. So it stains positive with past chain. So therefore that is clear cytoplasm seen in the tumor cell. And the fourth thing, see that in the nucleus of its tumor cell, so here hyperchromatized nucleus is present. And why hyperchromatized nucleolus is present in the nucleus? Because that is nucleolus stains dark. So therefore that is hyperchromatized nucleolus is present in the nucleus. So therefore see that in the nucleus of its tumor cell, hyperchromatized nucleolus is present. And also that is the most basic information. You can see that this is the stroma. So these are the tumor cells which are present in lobulated pattern, but you can see that this region is present between the lobulated tumor cells or lobules, and this is the stroma. And you can see that in stroma, so here that is lymphocytes are present, and this is the most unique feature of the seminoma. So therefore that is the sixth point, that is in stroma lymphocytes are present, and this leads to lymphocyte infiltrate. So this is the most unique feature, that lymphocyte infiltrate. So once again I am going to discuss. So here that in seminoma, that is all tumor cells are arranged in lobulated pattern. So this is a lobulated pattern first, and see that all tumor cells, they are uniform to one another in terms of shape, size and appearance. Second point. And third, you can see that in each tumor cell, so here that is in each tumor cell, so here cytoplasm is clearly visible, nucleus is located at the center, and also that inside the nucleus hyperchromatized nucleolus is present because it stains dark. And also you can see that in the stroma, so here lymphocytes are present. So these are the basic informations about a seminoma. Friends, so now I'm going to discuss what are tumor markers of seminoma. So first of all, as you already know that seminoma, that means a malignant tumor or tumor has been produced in the testis. Now you should know that in case of seminoma, that these tumor cells which are there, that these tumor cells, so here secrete some of the proteins or abnormal proteins in the blood, and due to which in blood the level of these proteins increase. Now on blood investigation, if these proteins are found in the blood, that means that these abnormal proteins show that there is some tumor or abnormal in the testis. So therefore that these are known as tumor markers. So simply what are tumor markers? I am going to explain in simple language that these tumor markers are the abnormal proteins which are secreted or released by the tumor cells in the blood. And these abnormal proteins, if they are found in the blood, then these abnormal proteins indicate that there is some tumor or abnormal condition occurs. So therefore these are known as tumor markers. Now in case of seminoma, what are the tumor markers? So in case of seminoma, the tumor markers are KIT, second OCT4, and the third one is the PLAP, that is placental alkaline phosphatase. So there are three tumor markers, KIT, OCT4 and placental alkaline phosphatase. So these are the, so here that is tumor markers of seminoma. So see about the tumor markers what I have written. So the tumor markers are KIT, OCT4 and PLAP. PLAP, the full form is placental alkaline phosphatase. So I have written about this. So see that, so here that is a tumor marker. So these tumor markers are the abnormal proteins, and these tumor markers, so here secreted by tumor cells in the blood, as you have already seen. Now here, and also the most important point, so here presence of these abnormal proteins in the blood indicate that is an abnormal tumor condition has occurred, and since this protein as abnormal proteins indicate about the tumor condition, so therefore these are known as, so here, tumor markers.